Thank you for joining today's Health Education and Learning Program webinar around the topic of organizational resilience. By attending this webinar, participants will be able to define the term resilience as it applies to healthcare, identify trust in the context of healthcare workplace relationships, list 3 components of mattering, describe 3 actions that either build a sense of trust or mattering. With that, I'd like to welcome our guest speaker, Dr. Jane and Betsy Jepson of Stratus Health, and we are honored to have you with us for this hour. Thank you for joining, and I'll now turn it over to Betsy.
Great. Hi, everyone. Just give me a second here and we'll get the slides up. Okay. It's good to be with you today. I'm Betsy Jepson. I'm Senior Vice President for Quality and Patient Safety Initiatives at Stratus Health. I work across our state and some of our national programs that focus on quality and safety. I'm an RN by background, and my clinical background is acute care and long-term care. And I'm sharing the stage today with my colleague, Jane Peterson. Jane, will you introduce yourself?
Hi, everyone. Thanks for having us today. I'm Jane Peterson, and I am the Chief Medical Quality Officer. And like Betsy, work across a lot of our different initiatives at Stratus Health. I am a geriatrician, have had the opportunity to practice in a variety of settings, both urban and rural. Most of my practice, which continues today, has been in long-term care, doing primary care for folks that are living in various senior communities. So I'll turn it back to Betsy to get us started.
Okay, thanks, Jane. So Kiana already covered our objective, so let's just move right into it. We call this first a resilience refresh, and it may or may not be a refresh for those of you joining us today. Jane and I shared a high-level overview of resilience about a year ago with this group, and so we're going to cover some of the same introductory pieces so that everybody's kind of coming along together, and hopefully it'll be a helpful refresh for some and introduction for others. And so we come at this perhaps a little bit in a less traditional way of how we think about or describe or define, if you will, resilience. And I'm realizing we're close to the lunch hour still, and we've got a few elements that introduce food. So I'm hoping we don't make ourselves and you hungry as we go along. So if you think about bowls, these bowls in the picture ahead of you as representing resilience and non-resilience, we want to use that as a way of kind of thinking about or describing it. So a plastic bowl is designed to be used in situations where one can expect the unexpected to happen. For example, let's say a small child is eating food in the bowl and it slips, falls to the floor while they're eating it. The design of that bowl is such that it can sustain that unexpected event, that situation. It can be dropped to the floor and not shatter or break. It's got features or inherent characteristics about it that allows it to not be disrupted during the unexpected, and it can go back to its normal shape, function, and use. It's resilient in that way. It has presence of strengths that allow it to adapt when conditions depart from what's expected. And so resilience is that ability to respond to disruption and quickly bounce back or recover. The glass bowl, on the other hand, more intricate in its design, but has some similar functional elements. It's got a rounded bottom, it has sides, it can hold things, it can work as a bowl, just like the plastic one. However, it doesn't have the same inherent features that would allow it to manage through or do well when the unexpected event happens. If it falls to a hard surface or it gets hit, it's considered the opposite of resilient. It's called brittle. It's unable to adapt to those conditions when it departs from what's expected. And so caring for people in healthcare is fraught with the unexpected. We have changes in volume that can happen rapidly. We have we're working with people, and we can have impulsive or unexpected behaviors in how we react to things. We can have unpredictable physiology that happens as a part of the reasons people are in our care. And these combinations of conditions can interact in ways that we can't always predict. So like the plastic bowl's ability to tolerate the unexpected, a healthcare system that's resilient can respond to these disruptions, and based on the scale of disruption, based on the different scale of these disruptions, can manage through, unless the healthcare system is brittle. A brittle healthcare system would not, they'd struggle to accommodate these disruptions. Sometimes even minor disruptions can lead to ceasing of the function or reducing the level of service that can be provided. So our challenge is, how do we make healthcare more like the plastic bowl and less like the glass one? Sometimes when we hear the term resilience, it gets intermingled with things like personal health and well-being. Sometimes it's talked about, in order to be resilient as an individual, we promote things like yoga and exercise and getting enough rest and things like that, all of which are very good. And they may, and to a certain extent, promote personal resilience to a degree, but resilience at the organizational level is not the same as promoting health and wellness for individuals within our organizations. They're different. It is great to promote individual resilience. It's important. And overall, it can help contribute to a workforce productivity. But to say that promoting health and wellness is contributing to the overall organizational resilience isn't really accurate. It may be translated that it's being promoting or driving towards higher productivity. If we feel well rested, and we're in good health, we probably are able to be more productive in that regard, but that's not the same as resilience. It's an important distinction to be made. We can be more productive in our work when we're in good health, but that doesn't necessarily mean we can accommodate disruptions in the same way. And being able to take on more busyness or the work of the day is different from resilience. So remember, resilience is that ability to respond to disruptions and bounce back and recover. It's not being able to work at peak performance all the time. That's not the same thing. And recovery and resilience doesn't necessarily mean that we return to exactly where we were before the disruption. In the last 2 years, our organizations and our teams bear the mark of the pandemic. It's just not possible to go back exactly where we were before this all happened, to the same place and how we operated. The question is, are we coming back from that being more rigid? Are we thinking we need stronger armor or more elaborate defenses to try to create the sense of security so that we can prevent anything like that happening again? Resilience would say that what we need is not more rigidity or thicker armor, but what we need is the ability to recognize where valuable adaptation happened and try to cultivate that. We need to help our teams to recognize and tap into what we would call enhanced response capabilities, those skills or capabilities that they acquired over the last couple of years that help them respond to the unexpected. So COVID gave us that opportunity to reflect, look back, and to look forward. It was a critical disruption that happened. It certainly tested our resilience, and in some cases is still testing that organizational resilience. It also has led staff across our organizations to rethink about how their work is valued and whether it aligns with what they value professionally. So we want to give you this mental envisioning, if you will, of a threshold. Think of yourself standing on a threshold. Behind you is where you've been. It may have been that there was incredible disruption that has happened in the past, and before you is the future. What awaits is not yet known. So the threshold's a good place to just hang in the balance for a bit, to reflect about all the changes that have occurred, and to think about how we will deal with change in the future based on where we've been. How can these concepts of resilience help us cross over and be adaptive going forward? So I'm going to go over these next few features pretty quickly, and then we're going to come back to some of them and go into more depth and dig in a bit more. So bear with me as I move through this fairly quickly, because we want to make sure we have some time for discussion at the end. These 4 elements, individual, team, leadership, and resources, are components that are important to resilience. So when we started, we talked a little bit about sometimes when you hear reference to resilience, it focuses a lot on the individual, but really the organizational resilience has all 4 components and they're all important. So we're going to just touch on each of them pretty rapidly. So individual factors that support resilience. And again, to point out, if you have an organization with individuals who are resilient, that doesn't translate to meaning the organization itself will have resilience. But having individuals inside your organization who have resiliency or are in line with or have features that contribute to the organization's resilience is important. Things like individuals who have a high team orientation, who place value on combined knowledge, so that sense of working with others who have expertise different from themselves and how it comes together makes and builds a strong team, and we'll talk about team in just a minute. These individuals who have high resiliency have confidence in using their own skills, and they have confidence in their own knowledge. Team factors that contribute to resiliency are teams that have quality of relationships. So if you think about how well-functioning teams can respond to the unexpected or adapt in situations where there's disruptions, it's completely different than if it's a dysfunctional team. They have the ability to innovate and flex in response. So quality of the relationships within teams are important. Teams that have a shared mental model, have the shared sense of what's the priority and what's the focus is important to the resiliency. Teams that have that adversity management skills, they have the ability to take on and respond quickly and rapidly when things are adverse, when there are unexpected or disruptions. And they are adaptable. So it's not that we always operate the same way and we assume that things are going to stay the same. They're prepared for the unexpected and they can flex in their role. In some cases, they're just serving as a team member, but in other cases, they may shift and take on the leadership role when that's what makes sense for the situation before them. Leadership factors that contribute to the organization's resilience. Leaders that design operational supports that help others, the teams and individuals be as flexible as possible are really helpful and important to resiliency. It helps to avoid rigidity, knowing that there are times when going outside the protocol is really what's called for, and supporting that in terms of operational supports is important. Creating a culture where it fosters and encourages trust and encourages speaking up in the face of the unexpected to make sure something important isn't missed. And it supports the appreciation of the collective and unique skills of individuals and team. That's a cultural component that leaders need to foster from a resiliency standpoint. And then valuing the staff with experience. Sometimes we lose sight of how important these individuals who've been with the organization have strong expertise in their particular fields, also have good, strong knowledge about the organization, because these are individuals we need to tap into for mentors for others as we're bringing them up in the organization, and provide opportunities for these experienced staff to succeed in their role. Leaders also, from the standpoint of resiliency, have to feel comfortable to be able to step away from their leadership role and turn that over to others in the team who might be best prepared to serve as lead given the circumstance that happened. And then finally, resources. And here what we're talking about is things like extra supplies, extra personnel. In these times when costs are tight and there's focus on value, there are times when we might actually have leaned down, if you will, or reduced costs or resources that were there that weren't recognized or seemed to be needed in the day-to-day. Yet having that little bit of slush is very important when it comes to times of disruption, so that it gives resources that teams can draw upon when they're in that unexpected or emergent situation. So having just a small amount of slush is really an important consideration in this times of when disruptions can happen. Then when we think about quality and safety and how it connects to resilience, on this slide, some of the common things that we draw upon to support quality and safety. And the question is, do all of these approaches support resilience, or might they inadvertently hinder it in some shape or form? All of these on this slide offer value and are important for the right use or for the right purpose, but some can in fact potentially inadvertently hinder resilience. The two that we think feel like align really well from a resilience standpoint: implementation science and high reliability. Implementation science is a methodology that is used for putting evidence into practice and considering the variation and the complexity of the local environment. So it calls for being able to adapt to the conditions in that local environment when you're bringing evidence-based practices into that setting. It allows for flexibility and innovation to happen as it bringing that new practice into implementation, and allows for adaptation during disruptions. High reliability principles include features that align with the characteristics we've talked about relative to teams and at the leader level, including things like supporting decision-making that's decentralized and deference to expertise, so that leaders have the ability to turn over that lead to those best equipped to respond and have the ability to function and improvise in the face of the unexpected. So those other elements on this slide have important purposes and serve a need in our quality and safety work. But we just wanted to be mindful that sometimes when we focus a lot on following a consistent process or leaning down, it may have some implications for our ability to be resilient. So I'm going to turn it over to Jane next to talk further in the topic of resilience.
Hi, everybody, and thanks, Betsy. So you're probably thinking, what does cherries have to do, and fresh versus dried cherries have to do with organizational resilience? Well, for me, sometimes when I'm talking about these, big concepts, and organizational resilience is a big concept, it really helps me it helps me to not get kind of caught up in all these words and things like that. To say, okay, look around you in your day-to-day life and find an analogy. And so it just happened to be that I had some dried cherries, and I thought, dried cherries versus fresh cherries. So if I was in an organization that was truly resilient, would I feel more like a dried cherry or a fresh cherry? Now you may think, so dried cherries, might be kind of, wow, that's like the epitome of resiliency. I mean, you can put them in a bag, you can put them in your cupboard, you kind of can forget about them for a while. You go to the store and you buy the dried cherries and they're pretty much consistent. They don't take a lot of maintenance. They're kind of there when you need them. And if you don't expect them to be fresh cherries and you just expect them to be the same and you expect them to all be interchangeable, well, that's a good dried cherry. On the other hand, fresh cherries, at least for those of us in Minnesota, are something we get only certain times, and when we get really good ones. And when we have those, we take care of them because you want to eat them in that window when they're really tasty, and you got to give them some special care. Put them in the refrigerator or not put them in the freezer. Do the right thing for them, and you appreciate them when you have them. You probably never eaten lunch with somebody and they've said, oh gosh, these are like the best dried cherries I've ever had. But you probably said, hey, these are really good fresh cherries. They're special. And I thought, I think I'd rather made feel like a fresh cherry if I was in a resilient organization. And so that's what I would feel like. And that kind of brought me to another story. I happened to be about a year-ish, well, it couldn't have been a year ago because we weren't wearing masks. So I had to be a little bit earlier than that. I was at a retirement party and most everybody there were healthcare people. And all the conversation just circled around how everybody felt unhappy, how they didn't feel appreciated, how nobody cared about them at work. And then finally, I struck up a conversation with the spouse of one of the folks there, who was a non-healthcare person, and kind of shared what we did. And he said, you know, he used to work in the mortgage industry and then decided he just needed a change. I went back to school to become a mechanic. And he loves his job because he now works for Metro Transit, which is our public transportation system here in Minneapolis, St. Paul. And he said, the thing that gives me the most joy is when I am driving to work and I see a bus go by and I see someone riding on that bus and they might have a dress shirt on, they might be reading the paper, they look relaxed. And he said, I know because that bus is running well, that person is going to have a good day. They're setting out there to, I know I've done something to matters. I've helped that person's day be better. And so it really hit me on this next topic we're going to talk about, this concept of mattering. So Betsy, do you want to advance? So this question of, do I matter? When I reflected back on this retirement party and the conversations, what I heard from the fellow I was talking to is he felt he mattered. And that really made him feel good. You could see he'd light up when he talked about his job. His shoulders were high. He wasn't slumped. His face was bright. As opposed to when I looked around at everybody else in the room, where their conversations were things like, you know, I'm just a cog in the wheel. You know, no one really cares about me. They only care about money. Now, to be fair, I think a lot of us who are clinicians know that we matter to our patients and we do get positive reinforcement from our patients. But what I was really hearing is they weren't working in organizations that made them feel like they mattered, especially as an individual. They didn't feel like they mattered. So next slide, please. So this idea of to matter is really a basic human desire. And I think the most important thing on this slide is the last sentence in bold. And that's that people around you know they matter because of you. It's not because of a sign in the bathroom. It's not because of little thank you, like little generic thank you notes. It's not because of pizza parties. It's not because of all those other things. They matter because of their interactions with you and with each other. And so there's three kind of basic parts of mattering, three kind of important components. And one is this idea of attention. And that is really very simple. Someone noticed me. They noticed me as a person. They didn't notice me as the doctor. They didn't notice me as, you know, the person on call. Someone noticed me, Jane. They paid attention to me. And importance. Someone cares about me. They don't care about just what I do or the role I play. They actually care about me. And dependence, that someone actually relies on me. So similar to the bus driver, he could see that person, even though that person didn't necessarily say it, someone relied on what he did. And he could see that within the work he does. And this is also kind of the place where I feel like some of the talks and some of the presentations on resilience get off track, because it's and we'll talk about it a little bit in the next. It's really about this interaction that's important. So Betsy, if you want to go to the next slide. So the impact of mattering. I don't know how many of you heard of the happiness trifecta. It's kind of the three hormones that basically cause us to be happy. And the interesting thing of mattering and the sense of mattering is it actually happens at the hormonal level. We actually, when people feel they matter, their serotonin goes up, their dopamine goes up, their oxytocin goes up. And I don't know, for those of you who are in the clinical role, serotonin's that hormone that helps us with sleep, memory, learning. It impacts our appetite. Dopamine is our kind of a motivation, arousal. Oxytocin, commonly known as kind of the cuddle hormone. It when you have oxytocin, your bonding increases, social fears are reduced. It builds trust and empathy. It also has some anti-inflammatory factors. So even mattering really at this hormonal level makes a huge difference. So next slide, Betsy. So why is this actually important? Well, mattering is important for some of the things that Betsy referred to. You know, when you look at what the roles of individuals are, either as an individual, within a team, or within leadership, it helps improve that self-esteem. It helps reduce depression and anxiety. It helps improve our health. But I think this is also where some of the presentations on resilience get a little bit off track, because this is where people can say, oh, it's all about personal well-being. If you just take care of yourself, then all will be good. And if we remind our staff of the importance of taking care of themselves, it'll all be okay, right? Well, unfortunately, it's not really that easy, because these are really doing this is it's embedded. The ability to show mattering has to be embedded in our policies, our procedures, our business decisions, and people need to be able to see it in our workflow, our staffing, and in our organizational priorities. Personal wellness is great, but you really can't expect people to go home and just fill up on happiness hormones, but not have that same supported in the workplace. So we really need to build our systems, processes, and cultures to support this type of hormonal response as well, if we're really going to achieve organizational resilience. So next slide. Unfortunately, we also have an enemy, and that is cortisol. And so this makes it not as even, it makes it even harder, it makes it even harder. So just like Cheeky, who is the name of my squirrel, is kind of my, enemy in regard to my bird feeder. Cortisol is really, and Cheeky drains my bird feeder. Cortisol is really what drains people in the workplace and in healthcare. Some of the fascinating things I found, as we were doing research for this talk, is there's actually studies looking at cortisol level in hair amongst healthcare workers compared to people not in healthcare. And they find high levels of cortisol in your hair. Again, I think this is another really good message that personal wellness will not take care of this. I mean, you can't wash the cortisol out of your system by going to yoga class and just to go take a bath in cortisol when you come back from work. And when you think of it, what we are working within in healthcare right now, we are stimulating cortisol. We have chronic understaffing, which leads to chronic stress. We have, and Betsy alluded to some of the efforts we do in quality and safety. We have sometimes this kind of error-free expectation, yet we're all human. And you hear people in healthcare saying, well, it's a watch your back environment, not a got your back setting. And people are constantly worried about being written up or disciplined for not following a process and procedure. And then on top of that, there's the traumatic stress. And I think that probably even increased more during COVID. My husband's an ICU physician, and he said, 9 out of 10 people that he put on event died with COVID. And, we think about, in healthcare, okay, well, we should be used to that. that isn't ever something you get used to. The more you learn about grief and loss, the more you understand it's not something you get over or get used to, even though there is an ICD-10 code for it, which is a whole nother discussion. It's really something that you carry with you. And in healthcare, we don't even really get good training on how to learn how to carry that with us well. So there's the traumatic stress. So none of this is a good basis for organizational resilience, but understanding it and acknowledging what's really happening at that individual level can make a whole lot of difference. So next slide, Betsy. So how can we really foster a sense of mattering in our organization? So I'm just gonna maybe as I've been talking here, you're thinking about the mechanic story, maybe you've got another story kind of roaming through your head. If you do, write in chat, maybe there's something you say, oh, wow, now that I think back on it, this really gave me a sense that I mattered. Or somebody did something and wow, that really, now that I think about it, that made me feel like I mattered. Or maybe you're thinking in your organization, oh gosh, maybe this is something we could look at in our organization that could change to really help foster this. So maybe those ideas come, just pop them into chat and share them, because I think it's sometimes these stories and that really help people kind of get your head around what are we really talking here and what does it really look like in real life. Next slide, Betsy. So I'm going to take 3 of the boxes that Betsy shared, and we're going to go into each of those slides just in a little bit more depth. And I put kind of an example that Betsy and I have thought of under each of the factors, under each of these areas. So let's start with the individual. So when we looked at the individual factors, like Betsy mentioned, there's this idea of a high team orientation. So when you think about the idea of mattering, we often assign people to teams, but that doesn't necessarily mean they feel that they belong on a team. So how do we, thinking of ways we can switch from assigning to developing our team in a way that people feel that they belong. They're not just trying to fit in, but they know they belong on the team because then they can have a higher team orientation. Value placed on combined knowledge. Taking time to actually just talk about the unique role of each person. Understand what skills you may not even know one of your other teammates has. And if you don't know, how can it ever get used in a team? And then just confidence in using skills and knowledge. Reward questions when people ask them. Encourage discussion. Encourage challenging each other and questioning each other in constructive ways. But have that be something that we help people develop those skills, because those are the individual factors that will help as we move towards organizational resilience. So next one. So likewise with the team factors, we talked about quality of relationships. So figuring out ways we can really encourage personal connections. It really does make a difference to know your colleagues at work. You don't have to be, best friends with everybody, but finding ways where people can just get to know each other and make a connection. Find, maybe some commonalities, maybe learning about each other's differences, which often are way more interesting than sometimes our commonalities. It's a great way to build relationships amongst teams. This idea of a shared mental model. It's rare that we have time to even stop and push the pause button and say, okay, how do we make it a practice to say, let's remind, what are we trying to accomplish here? Let's see if we can put into words, what do we all understand the same thing, and not have some person just say, here's what we're trying to accomplish. But to really say, okay, what do we think, what do we really want the outcome to be? And let everybody have a say in that and make sure that people really do understand versus being told that they understand or agree. Adversity management skills and processes. Train and reward emotional intelligence. I'm going to be honest. When I look at my physician colleagues, Not everybody comes in with the highest level of emotional intelligence. But what are some of the ways that we can foster that? Helping people speak to each other, communicate with each other. Many of you have probably been in team steps training. I think that's a great example of tools that can be used to help people with these kind of things within teams, with this kind of communication. And then this idea of adaptability. And this is where when we talk about quality improvement and this heavy focus on process, teams that are adaptable are able to know the process sometimes isn't always right. And that's a tough thing in the world we've kind of gotten ourselves into, where I think there's this feeling that if we just get all the steps in the process down and we do them in the right order, all will be good. But the process is a guideline. It's there to help us, but it doesn't fit every situation, and it doesn't fit any one situation 100%. So allowing teams this ability to practice and get used to being adaptive and using the process as a guide rather than a step-by-step manual that they just walk through. And then finally, leadership. So what are those leadership factors? So we talk about designing operational supports to enable flexibility. So how do your operations support staff, or do staff work to or staff to align with operations? So do you have mismatches here between what you're putting in place and what you're actually asking staff to do? The operation must support that flexibility. And it has to match with that. Creating a culture. You know, one of the saddest things I heard when I listened at that retirement party is how disposable the folks felt. And this was a mix of physicians, nurses, nurse anesthetists, folks that the person that I retired had worked in pulmonary and critical care. So you can kind of, expect kind of the colleagues. But across the board, they felt disposable. How do you create a culture where individuals don't feel disposable? And then that idea of valuing the staff with expertise. So really asking staff what should be done. They usually know, and then act on their recommendation. Don't just say, what do you think should be done? Okay, well, we'll take that back and take that under consideration. And then not do what they recommended, or not even follow up, or not even say why you didn't. That is one really good way to show staff that you actually don't value my expertise or what I say to you. So how do you build that into that valuing people with experience and listening to them to help make changes? Next slide, please. So back to some more food. I don't know if any of you have eaten poutine, but this one kind of came to me as an example of, organizational resilience is really not a simple project. It's not a project at all. It really is an undertaking that if you decide you want your organization to be resilient, this is a long journey. This is not going to be done in a month or two, or have a couple projects or assign a team to this. This is something that you expect to work on for the next years and probably continue to work on. So just like really perfecting a recipe, you got to search out those good ingredients, figure out the correct preparation, figure out the right techniques, think of how you're going to enhance flavor, and figure out how do you adapt. What happens if the kitchen gets moved and you got to get used to a new stove? It's really a lot like developing a complex recipe. And another thing is, sometimes it's very easy to kind of want to look the part of an organization that's resilient. To say, yes, we are very resilient. Look at our, all these things that we do for resiliency. But at the end of the day, the proof's in the eating. And so you don't want to get caught up on what are sort of, I guess, maybe artifacts of resilience. For example, this self-help approach and mass recognition of employees taking place over what really makes a difference or really make people feel like they matter. So I'd say, just like poutine, organizational resilience, it has a lot of ingredients. Mattering is just one of them. And the proof is how they all go together. And at the end of the day, what they taste like and the experience. So I'm going to move into one other component. And we're going to start this kind of Jeopardy style. And I'll give you the answer. And then I'll turn it over to Betsy to tell you the question. So the answer is, it is something that takes time to develop, is easy to lose, and is really difficult to build once it's lost. So Betsy?
Well, if that is the question or the answer, this is the question: what is trust? And so I think a lot of times we think we know what that is. It's a social process, critical to our relationships. It's what's needed to support cooperation in our organizations. It's part of that interpersonal interaction that we have. Trust is future oriented. It also depends on reliability, where if there's trust, that it creates the condition where one assumes others will do what they've committed to. It exists when there's greater tolerance. When there is trust, there's greater tolerance for the unexpected, and it ensures the ability to act in the difficult situations. So if trust takes time to develop, and it's easy to lose, and it's difficult to rebuild once it's lost, then how important is it inside our organizations? How critical of a component is it in the resiliency? We think it's pretty critical. And from the standpoint of, it's not only critical inside our organizations, inside our teams, but it also makes a difference from the standpoint of how do others external to us kind of view us from that perspective. So this is a slide that's from a Gallup poll that was capturing public's views of healthcare industry. And it is, the bottom green line represents views that are very or somewhat positive, and the top blue line represents views of healthcare industry that are very or somewhat negative. And you'll see over time that the gap gets a little greater and then gets a little lesser. But basically, any improvement in those views around the healthcare industry really isn't sustained. It tends to not be able to keep going in the upward direction in a positive way. And so views can be thought of as a proxy for trust, if you will. The same people who might be answering Gallup polls might be those who are in our organization. But if we don't have trust internally, how can we expect our patients or the public or others to trust us? So trust is an important feature. So how do you know if you have trust in your organization? If your staff trusts you, if you trust other leaders, and so like other things, it's something when you know it, when you feel it, if you will. So these are some of the things that are important or needed or inherent for trust to exist. Reliability, being a reliable leader or individual team member within your organization is highly important, so that your staff and your teams and your patients know they can trust that what's committed to will happen for them. Being willing to be vulnerable, it's putting your trust in others is important, so that if you're willing to trust them, that is something, it's a reciprocal feature, if you will, that is important with trust. Being respectful seems obvious, but in fact, at times, if we were to talk with our colleagues and staff, sometimes what we think that we're being respectful may or may not, in fact, be what's happening or how it's sitting with others. Allowing the benefit of the doubt. So this idea of being able to trust, again, if you can give the benefit of the doubt, you would be anticipating that the same would come back to you and be received in return. Having a willingness to have skin in the game, if you will, a sense of shared risk. If you think about how important that sense of shared risk is when we're in that times of great disruption, that people have the same perceived risk and also perceived shared trust about what's going to happen when we're facing that disruption. There's solidarity that can be found when there's shared risk and there's trust that happens. And then the sense of being able to give trust to others and not just expecting to receive it. These are important elements that are needed from the standpoint of cultivating trust. Excuse me. So if you think about how we build the systems and processes and cultures that cultivate trust, cultivate mattering, and help to build organizational resilience, if you have that combination of your staff and others feel like they matter, together with the presence of trust, it's like this incredible, strong PPE, if you will, that protective feature for your individuals and for your teams and leaders in times of that unexpected disruption, when things you can't expect happen and you need to be resilient and be able to cope with it and come back, bounce back from it. Excuse me. So we're back to where we started, where we're on the threshold and we have that opportunity to change the story. If you think about these two concepts of mattering and trust, what might you do differently as you cross the threshold? Now, we've got some questions that follow this, but we would like to pause right now if we could and just see how all this is sitting with you, how it's landing for you. Did it highlight something maybe that you're struggling with yourself? Maybe you're experiencing it, or you know, or you're sensing that there's issues around trust or mattering or your resilience within your organization. This puts a whole lot of pressure and stress perhaps on the shoulders of leaders, and many of you on the call are in that leadership role. It's not easy. It might be something you're struggling with yourself. It's very challenging when we think about how do we cross through that threshold and try to do something different if what's behind us is not the way we want it to be going forward. It can be hard to kind of recognize the patterns that we have, that we've built, that might in fact tear down sense of trust or does not cultivate the sense that our staff matter, that we matter for that matter. So no pun intended. But so let's just pause if we can and check in with you all and see what questions do you have? How did this land for you? What kind of reactions do you have?
There was a good example also put into chat about somebody who received a thank you note that was just very personal. It was really about them, not just a blanket thank you, good job. It was really very specific. And I think that's kind of it comes down to that, people know they matter because of you.
Yeah. Great, thank you. Any other comments or reactions? Chat as well. Well, while you consider that, we'll pause for you some of our questions. Let's see if I can get the thing to move. There we go. Okay, we just want to say no alcohol was consumed in this picture. Jane's dog, who stars in some of our slides here. So if you think about going forward, and if there's things, how we want to change that story, what needs to change for healthcare workers to trust that they matter? Any sense of that?
And kind of how we got to this question, I was thinking, I think back to, what do you think you could change, or if you were at, that retirement party or out with coworkers, what could change the conversation so that it didn't end up being folks thinking they didn't matter, but talking about, what are the reasons they do matter, or things that were positive.
There was an example shared in the chat where they felt there was a lack of trust between two of the clinics that were working together. So at the last staff meeting, they had a get to know you game, which included 20 questions and bingo. There was additional comment to answer your last question. Jane was very genuine concern for their well-being words.
Sorry. Okay,
Sorry. Very genuine concern for their well-being and words that are authentic and rich with meaning.
Yeah, it's very personal. I know one of the long-term care organization we worked with at one point, when they would have, a new staff come in, they'd have a night where that staff would bring their family, would be invited. They'd, maybe have a meal that, was special to that person, whether it was something cultural or just, something favorite. And people would get a chance, that the staff person would actually get a chance to know the people that lived in the long-term care facility as a person and family, as opposed to just another worker. And it really made a huge difference in people building relationships, not with just each other on the staff, but between the staff and the folks that they were caring for. A little harder to do in a hospital setting with patients, but you can think of how you could adapt something like that to just within the team setting, or whether it be a functional team or something like that.
I think sometimes too, we have healthcare workers listed here, but those on this call are leaders, and sometimes we make assumptions about that leaders know that they matter. It's just part of their job to support others or to support the organization's priorities in that regard. But I think that sense of knowing that you matter as a leader, because you're a person too, you're not just that, whatever your role is within your organization, it's an important all the way across, regardless of your role within your organization or your job. Everyone has that same sense or need for mattering. So another question to consider: if we feel we matter, are we better caregivers for our patients? Does it impact quality and safety of care that's provided? I invite you to share anything that occurs to you in that regard, if you think that sense of mattering carries through in how we interact with our patients and those that we work with.
One of the other studies that I looked at, now I'm not going to probably get the title right, but it talked about how patients felt that they had a higher quality of care when they saw the people around them working well together. It gave them a feeling that they were safer, and they just felt better about the care. We didn't really explicitly say this time either, but we did in the last presentation, that a lot of people like to equate resilience with burnout, but that we're not talking about burnout in this discussion. We're really talking about organizational resilience. And when you are looking at individual and team factors, if you haven't already addressed burnout, that is going to hinder your ability to move forward with organizational resilience. But addressing burnout is not the same as attaining organizational resilience. And burnout has been associated with an increase in adverse events and things like that.
See a comment in chat from Kelly that leaders often think that team building exercises will build a team, but that is most often not the case. If you already feel like you're on the team, the exercises do not change anything. And if you do not feel like you're on the team, the exercises only serve to make you feel worse, perhaps, or less accepted. Direct appreciation from leaders are for good employees is more important. Thanks for sharing that, Kelly. So I know we're running out of time here. And Kiona, do you need to do any final housekeeping items or the survey? Yeah, great. Okay, I'll turn it over to you. Thank you guys for being a part of the list. I hope you can take some of this with you in your what's next for you.
Well, thank you, Betsy and Jane, for your time together. I do request that you complete the 4 polling questions that are on the screen. The first 2 are the same exact questions that we asked at the beginning. They'll just help us gauge the knowledge gained throughout today's presentation. In the chat box, I have also put the link to the SurveyMonkey, which needs to be completed if you would like 1 ACHE credit for today's participation. The playback for today's webinar will be available within 5 business days, and we will also link part 1, so the presentation from last year in August, the part 1 of the resilience webinar. So this you can go back to watch that to see how it builds off of that, as well as have the playback for today's. If you have any questions or any other TA needs, we do encourage you to reach out to us at ript@ruralcenter.org, and visit our website for any other upcoming events. Thank you again, Jane and Betsy, for your time today. We really appreciate you, and have a wonderful day, everybody.